Iris constitutions. The very famous iridologist Dr. Joseph Deck of Germany did much of the research on ways we can use the color of the iris as well as the structure to determine the constitution of the body. This was further researched by Dr. Joseph Ungerer and Dr. Theodor Kriege of Germany as well. After questioning hundreds of patients with blue, brown, and mixed eye colors, they determined that each type of person had inherited specific common physical traits. The person's constitution indicates their built-in resilience and capacity to respond to the stresses of life. This is most helpful for the iridologist to know when working with a client. We must also keep in mind that the inherited constitution can be modified by environmental factors throughout one's life. Now we will learn about the iris constitutions as well as a health equation that will help us to understand how to better identify potential health conditions. And now I would like to teach you about the health equation. The health equation helps the iridologist determine the status of a person's health as follows. So the actual physical inheritance of a person is the iris. The iris shows us the genetic strengths and deficiencies of a human being. But we also need to look at their external environment. For example, what type of air are they breathing? What type of water are they drinking? What kind of nutrition and lifestyle are they living? Are they living a healthy life, eating well? Are they living a rushed, imbalanced life where they don't eat well? We also need to look at their internal environment. How are they living emotionally? Are they spiritually aware? Are they calm? Or are they very sad and depressed? What is their age? Is the person a young person or is the person an older person? So all of these things need to be taken into consideration when we're looking at the health of an individual, the physical inheritance plus all of the other factors. Now we're going to discuss three important iris constitutional types: the lymphatic, the biliary, and the hematogenic. The first is the lymphatic iris constitution that we have learned as a blue iris. Their tendencies are mucus arising from an overactive lymph system, an overactive immune system, infection of the mucous membranes. Their common reaction sites are their tonsils, adenoids, upper respiratory tract, lungs, sinuses, genitourinary tract, the lining of the stomach, intestines, and the joints. They may have skin afflictions such as psoriasis, eczema, dandruff, dry skin, or arthritic symptoms and stiffness, aching muscles. Kidneys overstressed, adrenal weakness, thyroid insufficiency, and digestive weakness. The biliary iris constitution has several tendencies. This is a mixture of a blue and brown iris. Their potential tendencies are liver and gallbladder insufficiencies, weakness in the pancreas function, gastrointestinal disturbances, digestive errors, disturbances such as constipation, diarrhea, flatulence, blood sugar highs and lows, liver and gallbladder problems may all be present in this type. The hematogenic iris constitution is the dark brown iris, and their potential tendencies have more to do with the blood, the composition of the blood, whether it's thick blood or thin blood, inability to store essential minerals, constriction and hardening of lymph tissue, hardening of blood vessels, disturbances in the gastrointestinal tract, digestion, and eliminative disorders. They often have a tendency toward anemia, circulatory insufficiencies, or glandular disorders, such as an imbalance in blood sugar, which would be the pancreas, or thyroid weakness. Liver, gallbladder, and spleen insufficiencies can also be possible with this type. There are several subtypes of the lymphatic eye, and I would like to review those with you now. They are the overacid, the febrile, the hydrogenoid, uric acid diathesis, and scurfrim. The overacid constitution. This is a subtype of the lymphatic eye. This person has a blue eye, but they have whitish fibers overlaying the blue iris. They tend to have an acidic body, arthritic tendencies. The kidneys may require extra support. They may have allergies, aching in the muscles called fibromyalgia, and you want to consider all the characteristics of the lymph constitution. The febrile subtype of the lymphatic constitution has even whiter fibers, as we can see here, and their tendencies are acute exudative conditions. They may cough a lot or spit up mucus. They tend to have fevers, especially as a child. Febrile means fevers. Tendency for arthritis or aching in the joints, respiratory infections, and we want to consider all the characteristics of the lymph constitution. The hydrogenoid subtype of the lymph constitution has what we call a lymphatic rosary that goes around in zone number 6, which is the zone of the lymph. And these people have extra tendency for lymph congestion throughout the body or in certain areas. They tend to retain fluid. Their legs or arms could be swollen. 2 or more tophi, such as here in the lung reaction field, can show a history of tuberculosis, which taints the vital force of that person who may have respiratory congestion. They tend to have allergies, possible weak digestion. Rheumatoid arthritis is often in the family history. An overactive immune system will cause allergies to certain pollens and dusts. They may react with eczema, skin problems, asthma, bronchitis. They just tend to have a lot of mucus throughout their bodies. The uric acid diathesis of the subtype of the lymphatic constitution has the tophi, but it's thicker, and it's often brought in farther, more into the zone of the muscles. And this uric acid diathesis is a tendency for gout or gouty arthritis. The term diathesis means in the state of having uric acid. Rheumatic or arthritic conditions may be known, kidney inflammation, possible stones, high levels of uric acid, tendency to reabsorb and retain excessive amounts of uric acid. They may have a structural weakness, inability to tolerate uric acid buildup. So their kidneys tend to inflame easily, and we see here really white kidney area. The scurfrim subtype of the lymphatic constitution, these people have a very dark skin zone in zone number 7. And that is going to cause them a tendency for suppressed skin elimination, skin disorders such as acne, psoriasis, eczema. The kidneys may be overstressed, a tendency for poor circulation, cold hands and feet. And you always want to think about the characteristics of the lymph constitution for these people. Now we're going to discuss the subtypes of the biliary iris constitution. There are only 2 subtypes in the biliary constitution, and those are called ferrum chromatose, tiger striping, and hydrogenoid. In the ferrum chromatose, tiger striping type, we see stripes going around the iris in bands of color, and there can be tiny little pigments that look like snuff tobacco in the iris. These people have a tendency for liver insufficiencies, digestive errors, especially if there's a central heterochromia, possible difficulty with fat metabolism, especially if there's a pinguecula, and possible difficulty with iron absorption. The hydrogenoid subtype of the biliary, these people have the tophi around in the 6th zone, and those tophi are going to be covered with a brown pigmentation, And they tend to have lymph congestion, fluid retention, allergies, and arthritis, just like in the lymphatic type, but you want to consider that they are also biliary and take care of their digestive tract and their liver. And now we have the ferrum chromatose subtype, and that is the only subtype by color in hematogenic. And the ferrum chromatose again is bands of tiger striping, tiny pigments that form tiger stripes in the hematogenic iris. And they tend to have liver insufficiencies, digestive errors, possible difficulty with fat metabolism, and possible difficulty with iron absorption. Lipemic diathesis, a corneal sign. Lipemic diathesis is not specifically a subtype, but it is a corneal sign because we can see it in the cornea. Here we see the lipemic diathesis coming into the cornea. The tendencies are high cholesterol. A frontal arcus up at the top may suggest cerebrovascular insufficiency. A medial arcus on the side can suggest coronary or pulmonary blockages. The ventral arcus may reflect insufficiencies of the hip, thigh, and leg arteries. They have a tendency for liver dysfunction with disturbed fat and or glucose metabolism. They have a tendency for cardiovascular degeneration. Cardiovascular risk is more significant when seen in people in the age range of 30 to 40 years than if you see it in an older person. Please note that lipemic diathesis is not considered a subtype because it is in the cornea. It's a corneal sign. So here we see lipemic diathesis in the blue iris, lipemic diathesis in the biliary iris, and lipemic diathesis in the hematogenic eye. All three types can have lipemic diathesis or the state of having lipids, and they will be in the cornea.